Coronavirus cases are way down across the state of Georgia. News Channel 6's Mary Calkins spoke with local infectious disease experts about what to expect going forward.
What a difference a month makes. The first week of September saw more than 300 people in the hospital with the coronavirus. 167 of them at University, 131 at AU Health, and 16 at the VA. Today, that number has dropped by 50%.
We've more than turned the corner. So not only are hospitalizations half of what they were a month ago, number of cases are down as well.
So what's behind the encouraging numbers? Doctors say it's because more people are getting vaccinated. Nearly half of eligible Georgians have gotten their shot.
A lot of the patients that have come into the hospital are unvaccinated. And because they're unvaccinated, they are sicker. And they're sicker means they end up in the intensive care unit and they end up on mechanical ventilators.
More vaccinations, more natural immunity through antibody production, developments that could signal a turning point.
I don't think COVID will be going away. I think we are moving from a pandemic to maybe an epidemic to maybe even endemic, meaning it could be like the flu, where we may need a vaccine every year.
Many of us thought that the last surge was going to be the last surge, but it wasn't. However, I think that this may very well be the last big surge. And I say that because more and more folks are getting vaccinated and more folks are getting natural immunity. So the virus is running out of targets.
Dr. MacArthur and Dr. Vasquez say it's likely there will be a yearly COVID shot in the future. In Augusta, Mary Calkins, WJBF News Channel 6.